Thank you, Jasmine. New fallout tonight after thousands of employees were laid off from the Department of Health and Human Services. Now, this is video of those workers in line outside the HHS this morning, waiting to learn their fate. 7 News' Josh Chapin is live in Bethesda with new reaction from a public health expert who warns about the ripple effects. Josh.
Yeah, Carl, some folks got their notices around 5 a.m. People who do public health, who do maintenance on different medical devices and communications. Some of these people getting that notice as they were on their way to the office this morning to places like the NIH.
There's no way that we will not eventually regret many of the cuts that happened today.
Craig Spencer knows dozens of people who were laid off. Some of those employees waiting in long lines like this one Tuesday morning outside the Department of Health and Human Services on Independence Avenue.
We're losing thousands and thousands of experts at a time when we need them more than ever.
Spencer is an expert himself, an emergency room doctor and associate professor of health policy at Brown University. Spencer worked in New York City during the beginning stages of the pandemic.
Getting rid of people at drug evaluation and research, at pharmaceutical quality, the Office of Regulatory Policy, all these kind of bureaucratic sounding names, those are the people. Cutting 3,500 people from the FDA, these are ultimately the people that do this work.
We also saw long lines outside the National Institute of Allergy and Infectious Diseases in Rockville, which is part of the NIH. We reached out to them for comment. They sent us to HHS, which referred me back to this last week, a statement touting an effort to streamline the agency, cutting from 82,000 full-time employees to 62,000. Robert F. Kennedy Jr. is the health secretary.
We're going to imbue the agency with a clear sense of mission to radically improve the health of Americans and to improve agency morale.
Dr. Spencer worried it's going to do the opposite.
We are going to have more outbreaks of diseases that we haven't seen in a long time. We're going to have things like measles going out of control in Texas, but eventually it's going to be even more concerning things.
Yeah, Dr. Spencer, as you can hear, worried about the public health infrastructure being destabilized, and he is worried that we won't be able to respond to outbreaks abroad in the same way that we always have. Carl, 1,200 jobs were cut here at the NIH. Carl.
All right, Josh, thank you.